Hello and welcome to episode number 3 of Ask the Longevity Doctor, the show where I put your questions about longevity and health to a medical professional. So my name is Chris Kerwin. I'm your host and I'm a master's student at UCL, specializing in cell and gene therapy. I'm also a research analyst for Gowing Life. And I'm joined today by Dr. Oliver Zollman.
Hello, yes, I'm Oliver and I'm a medical doctor based in Cambridge in the UK. And I'm founder of 21 Consulting, which is a company where we're trying to reverse the aging process by 20 years in all 78 organs by 2030.
So today we are talking about sleep. So as always, if you guys have any questions, please leave them in the chat and we'll get to them at the end of the show. So without further ado, Ollie, over to you.
So yes, I think today's topic is sleep. So sleep is very important for health, and it's a longevity level 2 intervention. So in the previous episodes, we talked about the longevity level 1, 2, 3 framework. And longevity level 1, as a quick recap, are things that add at least 2 years healthy life expectancy to nearly everyone. So these are things like diet, exercise, not smoking, not drinking too much alcohol, and calorie restriction. And that gets you a 95% chance of living to age 75 plus healthily if you do all level 1. And then the level 2 stuff, these are things that have less evidence for benefiting people as much as level 1 stuff at a population level, but can still be very important for a lot of people. And there's a lot more level 2 topics than level 1s, like 12, 13 different topics, sleep being one of them. And the impact of doing all the level 2 stuff potentially is that you have a 95% chance of being healthy up to age 92. So sleep is one of the main ones in level 2, and everyone has periods of bad sleep. So it's very important to, even if you don't have a clinical sleep condition such as insomnia or sleep apnea, I think it's very important, at least for productivity and general energy and quality of life, to know how to kind of hack your sleep and all the evidence-based interventions that you can do to help improve it.
So we often hear that we should be getting about 8 hours sleep a night. How crucial is this?
So yeah, the 8 hours number, it's pretty accurate. But the key thing is what your sleep biomarkers are showing for you individually. So some people may not get good quality sleep, but they have 8 hours total sleep. And then some people may do the opposite. So it's more about the quality, but the quantity, if the quality is good and the quantity is low, then that's okay in theory.
So when you talk about sleep biomarkers, what are we talking about there?
Yeah, so I've got a very interesting presentation on this. Spent a long time going through the literature. And so basically there are 33 different sleep markers which can be used to assess sleep quality. And total sleep time is one of them as well. So there's a presentation here. We'll post it in the link in the description. But as you see, there's all these markers across these pages here, and sleep quality is basically when you're in the optimal range for all of these markers. So we've got stuff like HRV, how many naps you're taking during the day, your Pittsburgh Sleep Quality Index score, which is a very common marker, like a questionnaire used in sleep medicine. Time to fall asleep, minutes awake at night, deep sleep, sleep regularity, blood pressure during sleep, how many times you stop breathing, snoring, melatonin, all these things. So sleep quality is quite complex. but it is getting a lot easier to measure now that we have something called the Whoop device, the Whoop watch, which I'm wearing on my
Sounds like
wrist right
fun.
now.
Mhm.
And that's very good for accurately measuring a lot of these sleep quality markers as well as total sleep time. And it's more accurate than the Aura Ring in terms of a lot of those markers, and it also measures more markers than the Aura Ring for sleep.
So we know how to measure sleep, but what are some suggestions for good sleep patterns for better health and well-being in general?
Yeah, so really a really simple one that most people don't do perfectly is sleep regularity. So there's a few ways of measuring this. You can either just look on your write it down in your diary and keep track of it, or it'll
Like
do it
sleep
automatically.
diary sort of thing.
Yeah, yeah,
Yeah.
yeah. Or there's often Apple Watch, Fitbit, Garmin, Whoop. They all do sleep regularity reasonably accurately. So you can see there. And in Whoop, you also get a sleep regularity score out of 1. So 1 is like perfect sleep regularity. And above zero point 0.9 is really good. And then below 0.8 is kind of bad. So with the Whoop, it's really nice because you can see that number and it gives you a nice graph of how regular your sleep is and how much quality it is as well on the graph. So really, you want a sleep regularity index for Whoop of above 0.9. That's really good. And if you haven't got the Whoop watch, which I do recommend getting anyway, um, I would just use the rule of thumb of go to bed and wake up at the same time 7 days a week at plus or minus 30 minutes the same time. It's a good rule of thumb.
So as you say, sleep is just so important in so many aspects. But does it affect your like quality of skin or health of your skin?
Yeah. So yeah, the dark circles under the eyes may be a bit of a myth. There may be more. Some studies have found no association with sleep time, but whether that's sleep quality, I don't think they looked into much detail. So it may be good for dark circles, or they may be a bit genetic. But skin aging and hydration, and also uh, eye dry eyes, which is it's related to hydration as well. These things, yeah, there's a bit more convincing evidence that short total sleep time or poor quality sleep is going to have you have dry skin, may age your skin faster over the years, and also very dry eyes.
So looking a little bit deeper than just the skin, does your sleep quality or lack thereof directly impact on things like chronic diseases such as diabetes, heart disease, and other like age-related diseases?
Yeah, so it's more about sleep quality than quantity. If you're having under 4 hours total sleep time, that's always bad. And if you're having under 6 hours total sleep time and it's poor quality, then that's bad and it's probably going to contribute to all these diseases in some way. But the worst case is when you have undiagnosed moderate or severe sleep apnea, and that goes on for years. And also if you have other rarer sleep disorders, these can be very disruptive. And also insomnia by itself as well is often linked to cardiovascular disease, hypertension, diabetes, if it is very, very severe insomnia. And if you have existing underlying conditions already, then it can exacerbate them. So
So
it's mainly if you have sleep apnea or insomnia that it's going to really start showing in these disease risks.
I mean, it's interesting you mentioned 4 hours because I always remember hearing sort of myths about, people like Margaret Thatcher who could get by on sleeping about 4 hours a day and could operate 100%. I mean, was that just a myth, or are some people able to do that on such a short amount of time?
So 1%, or it's estimated, we don't know exactly because it's still quite new and it relies on advanced genome sequencing technologies. But around 1% of people are thought to have familial short sleeper syndrome, FSSS. And that's where they may have a more efficient sleeping system. So maybe a more efficient lymphatic system, a waste clearance system in the brain during when they sleep. So they need less sleep cycles or shorter sleep cycles to do all the job of what a normal 8 hours sleep would do. So yeah, there's some genes which you can have variants in which cause you to have that, and then you can feel fine, but it's not well studied enough to actually know whether that's going to impact your health in any way. So the rule of thumb is, as always, measure as many markers as you can, sleep markers. Don't guess that you have familial short sleeper syndrome and you're going to be okay. And notably, I think Margaret Thatcher died of Alzheimer's.
I
Which,
think you're right. I think you're right.
maybe she had a ApoE4 genotype, so maybe it wasn't related to the sleep. But if she didn't have ApoE4 genotype and she had, reasonably early onset Alzheimer's, then that could be in theory related to such a short total sleep time.
Yeah, I've been looking at the ApoE genotype quite a bit recently, so we'll definitely do another episode on that and Alzheimer's specifically. But I think what really interests me is you mentioned was it the lymphatic system that is working while you sleep. So could you just give me a sort of a really brief explanation as to what that is and why we actually, like, what is that doing while we sleep?
So it's a very recent discovery. I don't know much about it, only the very basics, because, well, no one really knows much about it yet. But basically, it's the waste clearance system in the brain that is probably active at in some ways all the time, but the activity increases massively during sleep. And it's just to bring wastes out of the brain tissue and into probably the cerebrospinal fluid or into the veins, the venous vasculature, and then removing it to the rest of the body. So the liver or the bile ducts or the bowel or the kidneys and ureters and bladder, or the skin and the lungs can all get rid of those wastes.
So it's really very much a whole body thing, really, isn't it? It's not just your brain that needs a rest. It's so much more than that.
Yeah, for sure.
So are there any medications you can take which, if you're not getting the sleep that you need, that you can take, or to keep you just less tired during working hours?
Yeah, so a common one is caffeine. Technically, it's kind of a drug, really, because it has side effects and addiction and dependency.
Mhm.
All
Leave
these
wine.
Yeah. So caffeine obviously is a double-edged sword, because it'll do that. It can actually increase sleep quality as well.
Does that depend on what time of the day that you have it? So I imagine, if you have a cup of strong coffee at 10 o'clock at night, that's going to seriously knock your sleep.
Yeah, so it depends on your genotype a little bit. So I'm a fast metabolizer of coffee, according to my 23andMe genotype test for caffeine metabolism. And yeah, from personal experience, that's the same as well. So I can drink coffee quite late and I'm okay. But then other people, they're the absolute extreme and they literally can't drink coffee because the half-life, how long the coffee is in your bloodstream for, is ages and ages and ages. So they never really get rid of it. It takes a few days really for them to get back down to no coffee or no caffeine in their bloodstream. But yeah, so coffee can improve sleep quality if you actually, because it does increase melatonin secretion in some people. So that's an interesting kind of paradoxical thing. But yeah, normally for most people, it destroys sleep quality. There are lots of other drugs like mirtazapine, doxepin, suvorexant, and Z drugs arguably are like zolpidem. These things can all be really beneficial. Also melatonin, which is classed as a drug in the UK, as it's prescription only, and the slow release melatonin. Those are probably the 5 most common sleep drugs. A few of those are quite new in terms of being used for sleep indications, like mirtazapine, suvorexant, and doxepin. But they can really help with insomnia, total sleep time, and sleep quality as well. So deep sleep metrics. So it'll be interesting to experiment with them in some cases. of sleep disorders, or even on optimizing normal sleep as well.
And
But
are these sort of over the counter, or are they sort of
oh,
pharmacy?
yeah, these are all pharmaceuticals.
Okay, fair enough. Well, is there any link between obesity and lack of good sleep? Because as we said, it can affect so many parts of your body, and that is a serious problem that we see in society today, I suppose.
Yeah, so I think an interesting thing about the link between weight gain and sleep, it normally has to be worse than you think. So you have to have quite, consistently short, bad, irregular sleep for the long term, like months and months or years, for it to actually, very highly increase your risk of obesity. But the mechanism of action is quite interesting. So when you have a short or bad quality sleep, then it can increase your cravings for sugar, because your sugar levels in your prefrontal cortex, of your brain around here, they can be a lot lower. So then your brain is telling you to ingest sugar to increase those levels, and then you're going to eat more junk food rather than healthy food because you're craving that sugar.
I mean, that's absolutely fascinating, and that's definitely something I didn't know. But what is obstructive sleep apnea, and does that have a health impact?
Yeah, so it's very common age 90 plus. I think, yeah, it's over 50% of people have it at age 90 plus. So it's a good marker of brain aging, perhaps. So it's basically where you stop breathing by at least 50% for more than a 10-second period. And then that's called a hypopnea. And if it's over 80% reduced breathing, it's called an apnea. So apnea means no breath, hypopnea means low breath.
So what actually causes that? Is that you're literally not taking the oxygen into your lungs?
Yes, well, there's three types. There's obstructive, central, and mixed. And mixed is where you have obstructive and central. So obstructive is like 90% of cases, at least before age 90 plus. It's very common. And it's normally caused by, it can be genetic, or caused by your sleeping position alone, or caused by jaw problems, injuries to the face or neck area. Can be caused by being overweight. And then basically it's all about the tongue or the jaw and the throat not being in the right position when you're sleeping. And then that makes it hard to breathe. And then you don't get the air going through. And then that counts as a hypopnea or an apnea.
So it kind of worries me when you say it depends on your sleep position. So what sleep positions are the best to try and avoid this?
So it's best to get a sleep apnea test this is one of the fundamental things you should be doing with sleep, is to get a sleep apnea test. If you have any remotely bad sleep at all, you should try and get a sleep apnea test, especially if you snore or if you're overweight, because 20% of people in the world, it's that high, have sleep apnea, which is insane. So you want to get a sleep apnea test, and on the test, it'll tell you the positions that your apneas are occurring, if they are occurring at all. So normally, watch pat device or Alice device or black flash device, they all tell you what position you're in when you are stopping breathing. And you can see, oh, okay, I had 10 events where I stopped breathing on my left-hand side. Then I had like 50 on my back, and then 0 on my right-hand side would be one extreme example. But yeah, and there you can see that it's on your back based on the device that most of your positional sleep apnea events, it's called, are occurring.
So how does that test work? Because obviously you don't have someone looking over, noting down your position of sleep every few minutes. How does this test know, which way you're sleeping and whatnot?
So it's got a gyroscope. I think it's three-axis gyroscope, kind of like in your phone. So you wear like with watch pat, you wear a device here, and it's like a watch, and then has a finger sensor here. And in the watch, it'll be able to tell whether you're on your side here, or on your back here, or on your other side, like that.
Interesting. Yeah, that makes a lot of sense. So if you do this test and it says that you do have sleep apnea, then what's the next step there? What can you do to reduce this?
Yeah, so it's quite a complex topic. It would take a while to discuss, but I do discuss it in my sleep course and also in the presentation that we're linking below. But basically, there's 10 to 20 interventions that have randomized controlled trial evidence for reducing your sleep apnea score. And depending on how severe your initial sleep apnea is, you should start with different types of interventions. So if it's mild sleep apnea, then yeah, there's loads of things you can try. But normally, the gold standard for severe sleep apnea, other than weight loss or surgery, in very severe cases, is something called CPAP, and that's where you wear a mask and it blows air into your airways to help keep them open, regardless of your position or your jaw and tongue relaxing throughout the night. But that's not. It's great if you have it, but it's not the best. It's great. It's a great therapy if you have severe sleep apnea, but it's not the best solution in theory because you don't really want to be wearing a mask with your partner in bed, or it's a bit noisy as well.
Can't imagine it's the most comfortable thing in the world either.
Yeah, they're getting better. They're getting better, the newer generation ones, but there are 19 other options normally for sleep apnea. So it's worth trying to experiment with those, as a lot of them are they're all very safe as well. So look in the description for that presentation.
Okay, great. And so we've talked obviously a little bit about insomnia, but can you just tell us what it actually is from a clinical point of view?
Yeah, so I think there'll be a few, slightly different definitions between countries or even, sleep doctors. But generally, from my understanding, it normally means taking more than 30 minutes to fall asleep and for more than 2 or 3 nights per week for more than 3 months. So that's kind of clinical insomnia. Obviously, you can have insomnia for one night, where you just can't get to sleep and say, oh, I've got insomnia. But you don't have clinical insomnia because it hasn't been going on for about 3 months plus. Obviously, if it's really severe for only a week, then that's like, okay, it could be clinical insomnia because it's so severe. That'd be a fair judgment, I think. But yeah, there's two types as well. So that 30 minutes, if it's when you're falling asleep at first, it's called sleep onset insomnia. And then there's also sleep maintenance insomnia, which is where that 30 minutes is where you wake up in the night and then it takes more than 30 minutes to fall back to sleep. And there's slightly different therapies or interventions for each of those.
Okay, and say you're someone who, you probably don't have clinical insomnia, but you do struggle to get to sleep every now and again. Is there things that you can do, just around the house that are very simple, which can increase your chances of falling asleep straight away and maintaining that good quality of sleep?
Yeah, so the best thing is called cognitive behavioral therapy for insomnia, or CBTI. And this has got 5 components, and people with clinical insomnia, it works brilliantly. And it's great for everyone to learn anyway, because it just helps anyone. So they should teach it in school because it's like so simple and it's so effective and it's relevant to everyone. They should teach it in universities and companies as well. It'd be great. But yeah, there's 5 components. I've got a whole presentation on it on my sleep course because it's so important. One of those components is sleep hygiene. And that's like having your blue light filters on and all your devices, wearing red light glasses if you need to.
So what is it about light? So I've heard this numerous times. What is it about light that has an effect on your sleep?
Yeah, so blue wavelength visible light and also green wavelength visible light in about 50% of people. Both those wavelengths shine to your retina and they tell your brain to not release the circadian rhythm hormone, melatonin. So you're not going to release melatonin while you're staring at your screen at 11 p.m. at night. Whereas naturally, unless you're living in, northern Sweden in the summer where it's 24 hours a day light and it's awful. I've been there. Oh my God, it was so bad. But yeah, normally it gets dark by like 8 p.m. and then you're naturally falling asleep by 10 p.m. And there's nothing but candlelight or firelight. That's how our our eyes and brain evolved.
So I guess that's evolutionary, the reason, isn't it? It's a rising and falling of the sun.
Yeah, so it's very important to block that using flux app, justgetflux.com. You need to get that on your Mac, on your desktop, on your or Linux or whatever.
Mm-hmm.
And then you have all the apps built into phones. So they all have like night shift now. That's really important. You want to put it on the strongest setting. You can also get like Philips Hue lighting in the house. I've got that. It's really good. Or there's like, cheap hack alternatives where you just turn the lights off rather than having the lights go red late at night. But yeah, that's an example of sleep hygiene. Also, not eating late past 8 p.m. That's like, if you're going to sleep at like 11 p.m., you want to give like 3 hours before you're sleeping. That's another sleep hygiene technique. My third favorite sleep hygiene technique is total blackness in the bedroom. So it should be so dark that you can't see your hand when you're in your bedroom. And that this is like a really simple thing that people, I've seen a lot of people, they just, they get so much better quality sleep as soon as they put in blackout curtains. And they're really simple. You can buy on Amazon like 20 quid blackout curtains.
Yeah, I've had them before, and they're brilliant. You don't realize how much of a difference they make until you have them, and you're like, how could I sleep any differently?
Yeah, and blocking out all those blue LEDs from your devices in your bedroom, that's important too.
Yeah, I mean, I'm glad that you say that, because I've got all the night shift modes set on my phone. I never know if they're actually having a big effect, but it seems like they are. So that's good news.
Yeah, well, that's one component of CBTI, and then there's 4 more. But yeah, I'll take a while to go over them. But the second most important one, well, the second and third most important ones, I think, are sleep restriction, which is basically time in bed restriction. So you literally don't, you choose fixed hours to stay in your bed. So say it's like midnight to 8 p.m. and then you don't stay in your bed and don't get into your bed until you're in those, until you're in those times. You're only in your bed for that time. So, and that's really important for fixing sleep schedules and not being able to get to sleep.
So because I know, myself, I love a nap every now and again. Is that a kind of a unsustainable habit to get into, do you think, if you're actually trying to maintain good sleep?
So naps are fine as long as more than half an hour napping a day is unusual. And like maybe if you're a professional athlete or jet lagged, then obviously it can make sense. But for most people, you want to nap under half an hour, under 25 minutes per day, because after that it starts messing up your sleep drive for late at night. So it'd be better to nap. I wouldn't nap past 6 p.m. or even 5 p.m. If you're going to bed around 11 p.m. And you want to keep a nap to 20 minutes. So you want to set a nap alarm on your phone or your watch. So you start your nap. You don't even have to fall asleep. It's still, as long as you're like relaxing and everything, it still counts and helps you regain energy and lower your blood pressure and relax and everything. But yeah, set an alarm for 20 minutes. And another hack you can do is you can do a nappuccino. So it's where you have a coffee, because caffeine takes about 20 minutes for most people to start hitting their system. And then you have the nap plus the nappuccino together, and you're going to feel so alert after that.
Now that is a life hack and a half. That's brilliant.
The main risk is napping too long, because then you get something called sleep inertia, which is kind of like how you feel when you wake up in the morning in a bad way. But you get that after napping for 30 minutes. And that's because you're starting to go into, middle sleep and deep sleep. And you don't want to do that. You just want to stay in the light sleep and then kind of middle sleep if you're doing the 20-minute nap.
So, often in the morning I woke up after having, a good sleep, and I just feel knackered and tired still. Like, why is that? Have I overslept, or is my sleep quality not been ideal?
Yeah, there's lots of different causes. Like it could be, low blood sugar overnight. It could be irregular sleep, like we were saying earlier. So you're not used to waking up at those times, or you overslept on the weekend. That's super common. Could be alcohol from the previous night. Could be eating too late. Could be, just not doing any of the sleep hygiene stuff we're talking about. So having blue light super late at night, that can cause it. Could be being too hot in bed. Could be being too cold in bed. It could be a lot of different things. So yeah, but sometimes even if you do all that, you're still gonna have a little bit of sleep inertia when you wake up, and that's normal. for the first 10, 15, 20 minutes after you wake up.
Yeah.
One way of getting out of it is to do some breath work, so like deep breathing. So you can like take a really deep breath in, hold it for 5 seconds, then out for 5 seconds. Do that for like 30 seconds, and often it helps a lot for me personally.
Okay, yeah, that's a good tip. Yeah, I think I ticked probably most of those boxes that you mentioned, so I'll definitely try that. But one thing, one person who probably enjoys a nap more than me is my dad. How do you maintain good sleep quality as you get older?
So you get a Whoop watch, and then you buy my Sleep Hack Me course. But also, well, yeah, there's some good resources out there, but that's partly why I made the course, because the resources out there are only focused at insomnia, and the resources out there are great for that. Although they can be quite expensive, but you can get them free on the NHS in the UK. But I'm not sure about outside the UK. So the insomnia resources that are out there are really good. That's okay. But insomnia is only one part of of sleep, and you can still have really bad sleep quality, but you don't have insomnia, and you don't have sleep apnea, and you don't have any like rare sleep disorder. You can still have awful sleep quality. So that's why I made the course. So to try and have a really good evidence-based resource. And the key thing is to get this Whoop watch, this one here, and learn how to do self-experimentation to optimize your sleep. So you want to be trying a new intervention for like 7 days and seeing how it improves the markers on your Whoop watch or in your sleep diary. But Whoop watch is better really. And then you want to try a new intervention and keep trying new interventions for each week to try and solve the problem and solve all your markers.
Amazing. Well, brilliant. I think we'll wrap it up there. So thank you so much for joining me, Ollie. It's been an absolute pleasure again. I know you mentioned your sleep course, which is just coming out. Is there anything else you'd quickly like to plug before the end?
Yeah, so for a more comprehensive solution to health, there is Longevity School, which will include all of the sleep stuff as well. But it's every part of your health, so it covers all of level 1, 2, 3. But I do have this bespoke Sleep Hack Me course, because sleep is such an important topic that's underserved by good evidence-based resources at the moment.
Brilliant. Well, yeah, go and check it out. So thank you so much for watching, guys. Please remember to go and check out the Gowing Live website as well, gowinglive.com, where you can check out all the latest news and updates from the world of longevity and health. So without further ado, we'll see you again next time. Thank you very much.
See you.